Hello students, welcome to this session. Today we are going to study about disinfection, that means how to clean the surfaces. The learning objectives at the end of the session, you should know the types of disinfectants, cleaning agents and method to test the efficacy of the disinfectant. Disinfection is the process that destroys or removes most of the pathogenic organisms but may or may not be the spores. So it is achieved by physical or chemical agents. So classification of chemical agents. So first type is alcohol group, that is examples ethyl alcohol, isopropyl alcohol, aldehyde, formaldehyde, glutaraldehyde, halogens, iodine, chlorine, phenol, cresol, lysol, chlorhexidine, oxidizing agents, hydrogen peroxide, dyes may be malachite green, crystal violet, metallic salts of silver, copper, mercury, gas sterilization by ETO, ethylene oxide or plasma sterilization. Now let's see the level of sterilant or disinfectants according to their microbiological actions. So these are the 5 factors for the microbiological actions on vegetative bacteria, bacterial spores, tubercle bacilli, fungi, enveloped viruses and non-enveloped viruses. So sterilant is kills all the forms of the microorganisms. Then in disinfectants there are 3 types: high level, intermediate level and low level. So high level disinfectants kills all the morphological forms of the organisms except bacterial spores. Intermediate level do not kill or destroy bacterial spores but they can damage all the microbiological forms. Low level, they do not kill bacterial spores and fungi plus minus, non-enveloped viruses plus minus. Factors influencing the efficacy of the disinfectant. So it is organism load, nature of the organisms. So example, prions or bacterial spores are highly resistant than the other microorganisms like mycobacteria, viruses, fungi or vegetative bacteria. Then concentration. So optimal concentration is required. Then contact time, temperature, stability, relative humidity, biofilm formation which prevents entry of disinfectant. So these are all the factors. An ideal disinfectant should be broader microcidal activity, fast acting, not affected by the organic matter, non-toxic, then compatible with the material, odorless and economical. The antiseptics is a type of disinfectant which is safe to apply on the body surface, that is skin and mucosa, which results in the destruction of the organisms. Then cleaning or decontamination is the reduction in the pathogenic microbial population to a level at which items are considered as safe without protective attire. Spaulding's classification of medical devices. So they are categorized into the critical device, high risk, semi-critical device, that is intermediate risk, and non-critical device, that is low risk. So critical device is item that enter a normally sterile site. So they are invasive. The examples are surgical instruments, implants, prostheses, rigid endoscopes, syringes, needles. So the recommended method is sterilization. Semi-critical device, they are in contact with the mucous membrane or body fluids but they do not enter. So they are respiratory equipments, non-invasive flexible endoscopes, bed pans, urine bottles. So the recommended method is disinfection, that is high level disinfectants. Non-critical or low risk devices, they are in contact with the intact skin. So non-critical patient items like an environmental surfaces. So the method of recommendation is the disinfection, that is intermediate level or low level disinfection. Agents used in the hospital for achieving sterilization, disinfection and cleaning. So they are divided into the high level, intermediate level, low level and agents of the cleaning. So high level disinfectants, the examples are aldehydes, in that formaldehyde and glutaraldehyde, peracetic acid and hydrogen peroxide. Intermediate level disinfectants are alcohols, example ethyl alcohol, isopropyl alcohol, phenols, then cresol, lysol, halogens, iodine and chlorine. Low level disinfectants, quaternary ammonium compounds and chlorhexidine. Agents of cleaning are enzymatic solution, detergent, soap, either antimicrobial or plain soap. So let's see the disinfectant. So first is high level disinfectant, so capable of killing all the microorganisms plus bacterial spores. So first is the aldehyde. Commonly used are formaldehyde, glutaraldehyde. So mechanism is combine with nucleic acids, proteins and inactivate them. So the formaldehyde is excellent high level disinfectant. Uses, it is largely restricted to non-patient care area for preservation of anatomical specimens, histopathological specimens and stool specimen. The fumigation of OT is nowadays practice not used. Disadvantages, it is irritating and pungent odor and potential carcinogen, corrosive, causes skin irritation and asthma when inhaled. Glutaraldehyde, so it is used for the semi-critical items like endoscopes, cystoscopes. So it is also used for aerial disinfection and cleaning, that is fogging and cleaning of floor and surfaces of the critical areas. So example, bacillocid is used in the concentration 2%, it is example Sidex. Duration is 20 minutes and for spores is 10 to 14 hours. Advantages, it is active in the organic matter. Disadvantages, pungent odor, can produce eye irritation and asthma and contact dermatitis. H2O2, hydrogen peroxide. Mechanism of action, it produces hydroxyl free radicals which are toxic and attack the various cell components. The uses are sporicidal, more than the 4 to 5% concentration. 3% H2O2 for the environmental surface disinfection, fogging and wound cleaning. 3 to 6% H2O2 for disinfection of the soft contact lenses, ventilator, endoscopes. Say 6 to 7.5% H2O2 as a chemical sterilant in plasma sterilization. Vaporized H2O2 used in the industrial sterilization of medical devices and for decontamination of the large and small areas. Advantages, rapid in action, non-toxic and active in the presence of organic material. Disadvantages, expensive, can cause chemical irritation, corneal damage, should be stored properly in the dark containers. Second is the intermediate level disinfectant. Example is the alcohol. So it can be used in preparations like ethyl alcohol, isopropyl alcohol, most popular alcohol in the hospitals. Action, rapidly bactericidal except spores. Action by denaturation of the proteins. Uses, alcohol mostly used in the concentration of 60 to 80%, can be used as the hand rub. Example, sterilium. Disinfecting smaller non-critical instruments like thermometer, small medical items like vaccine vials or external surfaces of the equipment, stethoscope. Disinfection of non-critical surfaces, lab bench area. Disadvantages, flammable, must be stored in the cool ventilated area, evaporate rapidly, may damage the tips and lenses, inactivated by the organic matter. Second is the phenols. So phenol, carbolic acid, first widely used as an antiseptic by Joseph Lister. Mechanism of action, disruption of cell wall and cell proteins. So there are two uses, used as a disinfectant, example Cresol or Lysol. So it is used as a disinfection of the environmental surfaces, that is bedside tables, bed rails, laboratory surfaces, non-critical medical devices. It is toxic to skin, so not used as a antiseptics. 5% phenol can be used for the disinfection of the sputum specimen as a mycobactericidal. Used as an antiseptic, so it is chloroxylenol. It is an active ingredient of the Dettol. So widely used as an antiseptic. And advantages, it is active in the organic matter. Disadvantages, may cause hyperbilirubinemia in the infants. Third is the halogens. So iodine and chlorine are the examples. They have antimicrobial activity. So first is iodine. Mechanism is disruption of protein and nucleic acid. So there are two preparations, tincture iodine, 2% iodine in potassium iodide, and iodophore, it is povidone iodine, example is betadine. So it is used as an antiseptic. So 5% topical solution and ointment for wound healing, 7.5% for the hand scrub, 10% for the surgical skin preparation, 1% oral antiseptics or for as a mouthwash, and as a disinfectant for the medical equipment. So it is also used in hydrotherapy of the tanks. So next is the chlorine and hypochlorite. Mechanism of action is the oxidation of cellular materials and destruction of the vegetative bacteria and fungi. So there are two preparations, free chlorine and hypochlorite. Hypochlorite is available in liquid form, that is sodium hypochlorite, or household bleach, and powder form, calcium hypochlorite or bleaching powder. So uses of the free chlorine: disinfection of the municipal water supplies and swimming pool water, also in the dairy and food industries. Uses of the sodium hypochlorite: it is available in the concentration of 5 to 6%. It should be used in appropriate dilutions for disinfection of various hospital supplies. Contact time 10 to 20 minutes. Advantages: it is broad spectrum, sporicidal, rapid and non-inflammable, and low cost, widely available. Disadvantages: inactivated by the organic matter, toxic to skin, mucosa, carcinogenic. So daily preparation may cause corrosive damages to the fabrics, carpets. Hope you find this session useful for your understanding and for your exams. Thank you.